Hey everybody, it's Kay with our big question of the day today. And today we have an arterial blood gas, and we're going to talk a little bit about anion gap as well. So the following ABG is received. We have a pH of 7.16, PCO2 of 44, PO2 of 72, bicarb of 12, and a saturation of 90%, an anion gap of 14. The most common cause for this type of acid-base disturbance in critical care is, take a moment and look it over, is it tissue perfusion, inadequate mechanical ventilation, ketosis, or diarrhea? Take a moment and look it over. Okay, so let's start out with the interpretation of the arterial blood gas to start out with. We have a pH of 7.16, very acidic, very concerning, right? PCO2 of 44, which is normal. PO2 of 72 and a bicarb of 12. Saturation of 90%, anion gap of 14. So, what is our primary acid-base disturbance? Well, we know the patient is very acidic. We have the respiratory parameter, the PCO2, normal at 44, and then we have a bicarb of 12. And so what do we have going on here? We have a metabolic acidosis. That's the primary acid-base disturbance here. And now the anion gap is 14. So when you have a metabolic acidosis, remember, a metabolic acidosis, typically all the etiologies of metabolic acidosis really kind of fall under two primary categories. Either it's because of acid gain or bicarb loss. So whenever your patient has a metabolic acidosis, ask yourself, is my patient retaining acid or getting rid of base? And you look to the anion gap to give you that answer. If the anion gap is normal, your patient is losing bicarbonate somewhere. And the most common place for that, the most common way that critically ill patients lose bicarb is diarrhea. The others, A, tissue hypoperfusion, B, inadequate mechanical ventilation and ketosis. Well, think, inadequate mechanical ventilation is going to affect our respiratory parameter. So that's not the right parameter, that is not the right answer because our respiratory parameter looks fine. Now, tissue hypoperfusion and ketosis, they're definitely in the running, right, for causing metabolic acidosis, but they are not the culprits here. Why? Because the anion gap is normal. So then you think about bicarbonate loss, because tissue hypoperfusion and ketosis will cause acid gain and raise that anion gap. And that's not the case in this particular scenario. So the answer is D, or diarrhea. Thank you guys for joining me for another question for today. Please come see me over on the website, khappypresents.com, or if you'd like to get in touch with me, you can email me at k@khappypresents.com. Take care. Bye-bye.